I mean, it's not the body, it's not the mind. Kumbaga sa religion, it's the soul, parang ganun kasi ang spirit. So that all the three aspects should be balanced para nang sa ganun ay makonsider natin ang holistic aspect of a person. So the 9 interrelated facets of health, ang dami niya, no? Physical, mental, and spiritual, and the personal methods of maintaining health, protecting health, and restoring health. So that in this table, nakikita dito ang kunwari ay maintenance of health physically, yan. Maintenance of health mentally, maintenance of health spiritually, ganyan. So nakikita na natin dito ang how now this could be an interrelated occurrence in a certain person. Okay? So protecting health physically, ito na naman yung mga facets. Mentally and then spiritually. Restoring health. So physically, mentally, and then spiritually. So there are different facets now on maintaining or managing now physical, mental, and spiritual aspects of the body or of health. And actually, per culture, per religion, iba-iba po yung kanilang practices. But most likely na they are under all this also. So example na lang ng kunwari na lang ay restoring health. So when you say restoring health, you are sick now and you would want to go back to your normal self or magkaroon ka ng homeopathy tuloy, homeostasis or balance. So that physically you can use all this like homeopathic remedies, liniments, herbal tea, special food, massage, acupuncture, or moxibustion. So that those are some of the uh, solutions kumbaga to restore health physically. Mentally naman, okay, you can resort to relaxation or parang meditation, mga ganon. Exorcism in other cultures, they go in this area kasi nga yun ang belief nila. Curanderos, yung kanina, yung sa may Mexican, and the healers or traditional healers and your nerve teas. So, mas malalakas na naman na teas that would now target yung nerves managing now your mental aspect. Okay? And then sa spiritual, religious rituals, special prayers, meditation, traditional healings, and exorcism. So ganyan yung mga iba-ibang manners of a person's way of curing. Okay? Of course, ang pinakasikat is the Western, yung medicine sa restoring health. Ultimo physical, may panggamot sila. Mental, may gamot ulit sila. Sa spiritual lang sila naglalag ng konti. Although, kung minsan sa iba, spiritual is also explained to be parang related to yung mental aspect of health. Okay? Pero sa culture, ayan, ibang culture, iba ang practice. So, cultural differences should not lead to health disparities. Sabi nga natin. So, kahit na anong kultura, anong lahi, anong itsura nung lahi, wala dapat disparities. So, di ba? Tayong Pilipino kasi mga judger tayo minsan. So, kung mas maputi, mas inaasikaso natin. Mas gwapo, mga ganon. But I hope we don't see that. We don't see that in nurses. Okay? So, kasi nga, it's unfair. I mean, it's not fair it's not fair to judge because lang of a certain group or a certain race. Okay? So when you talk about spirituality, it's closely associated with culture na rin. Kasi nga, more on beliefs yan. Okay. So, spirituality versus religiosity, same ba? Opposite or related? So, ito yung ating i-decipher later. And then, we now define some terms, agnostic or atheist, okay, and other spiritual guides. So, let's talk about spirituality and religiosity. So, this is defined sa religiosity, usually applied to ritualistic practices and organized beliefs. Okay, based on a certain religion. Yan. So meron silang basis, tapos pinapractice nila according now to a basis. Okay? And then spirituality naman, generally thought to refer to the human tendency to seek meaning and purpose in life, inner peace and acceptance, forgiveness and harmony. So itong spirituality na to is relative, meaning it's a subjective search for the meaning. So kahit na Catholics kayo pare-parehas, iba yung spiritual effect sa inyo ng Catholicism. Ganon. Iba yung, di ba, yung iba kasi very, anong tawag nila sa Tagalog ay sarado katoliko. Yan. Okay, so because ibang spirituality ng sarado katoliko sa hindi sarado, sa hindi ganon ka fervent or hindi ganon ka, what do you call this? Hindi masyadong, yun nga, hindi masyadong, yun, basta sarado katoliko kasi is parang very strict ang kanyang compliance. Yung iba naman, Catholics, but they're not so strict in practicing. So ganon kasi, iba-iba kasi ang spirituality. So that people, depending on their experience, tend to have different meanings of of religion, different meanings of yung finding purpose, peace, acceptance, mga ganun. Iba-iba tayo. So that kahit nga magkapamilya at parehas na ang relihiyon, magkaiba pa rin ang spirituality level yan. Kasi nga, nababase lahat yan sa experience natin. And that experience would include social experiences. Okay? So if the person kasi is exposed, for example, to kind people all the time, all day, every day, okay? Tendency is that the belief of inner peace, yung finding meaning, hindi masyadong mahirap kasi nga hindi chaotic yung environment. Comparing it to somebody, kunyari kapatid mo, tapos naipasok siya sa isang institution na maligalig, bully, mapang-api, ganon. So iba ngayon yung nafe-feel niya at naiisip niya about life. Ay, ganito palang buhay, ang hirap naman, yung ganon. And hence, iba ang dating sa kanya nung religion, spirituality because of his experiences. He's more into I need to find myself because I need some inner peace, mga ganon. I need to do this for the calmness of my mind, ganon. So kasi may ibang experience yung utak na nararanasan. Kaya nag-iiba-iba tayo. Okay? So ganon ang difference ngayon ng religiosity and spirituality. Okay. So although may overlap si spirituality, okay, at saka si religion, ha? So a spiritual person, informal, non-organized, subjective. So meaning, sariling experience, sariling paniniwala, bakit ba? Ganon ang spiritual person. Religious person, on the other hand, is formal, organized, objective. Kasi nga, recognized legally, kunyari na lang ng mundo. Like for example, Catholic Church. Yan. Okay? So that may beliefs, may libro sila, may doctrine sila, ganon ang religion. Okay? So on the other hand, atheist naman, one without belief in a deity. So hindi sila naniniwala sa isang God, ganon ang atheist. Okay? So sa Philippines hindi masyado ang practice ng atheism because of the spiritual natin, masyadong religious ang Filipinos. Hindi man Catholic, pero meron siyang religious affiliation. So that ang tendency kasi if you're an atheist, hindi mo nire-relate yung sarili mo to any religious group or sect. Okay? Kasi nga you don't believe in a deity, which is a very much practiced belief in the religious, if you are belonging to a religion. Okay? Agnostic person, on the other hand, is a person who doubts the existence of God or a supreme being. Okay? Agnostic person. Lagi niyang kino-question, nakita niyo na ba si God? Ba't kayo nagbibilieve kay God? Mga ganon. Okay? So, religious-wise kasi, iba ang paniniwala natin, di ba? Na kahit hindi natin nakikita si God, we believe in a supreme being. Ganon ang religiosity. Okay? So, ganon yung difference ngayon ng religious or spirituality ng isang tao. And hence, again, we don't question. Okay? So, for example, sabi niya, okay lang, kahit ano, I don't believe in God anyway, or parang ganon. Wag mo silang kokontrahin into saying na, "Hay, mali po yan, ma'am, sir. Dapat po, we believe, we have to have faith," mga ganyan. Kasi nga, ang paniniwala nila, walang existing na God, ganon. Or, yung mga ganon. I'm not so sure with the beliefs of an atheist, pero parang yun ang pinaka definition nila. Okay? So, again, the negotiating can occur, but never can we impress our faith on them or our beliefs in them. Hindi natin pwedeng impress sila or i-impose sila ng paniniwala mo kasi nga iba yung paniniwala nila. Okay? So, when you talk about spiritual assessment, ano ba ang ating tinitignan dyan? So, it's an active and ongoing conversation that assesses now the spiritual needs of the client. Initially, hindi mo agad makikita yan. Hindi mo mai-interview yan. Ano po ang spirituality nyo? Hindi mo yan. Pero pwede mong tanungin, ano pong religion nyo? Di ba? So, spirituality now will be assessed only when you are interacting with the patient often. Okay? So that ongoing conversation will tell you, ay, may something to. Yung ganyan. Madidetect mo na there is a certain need, there is a certain lack, ganon. As you now go through the conversation na madalas with the patient. So from there, maa-assess mo na yung need ng patient spiritually. Covering now from the formal and informal cues. Okay? Okay. So that ang tendency is that magva-verbalize siya. Okay? Yung parang gulong-gulo ang isip ko, yung mga ganyan. Magva-verbalize siya on her spirituality. Okay? Or yung meaning of life, mga ganyan. Lalabas yan. Pag yung close, trusting na yung relationship nyo and nag-uusap kayo ng medyo mas malalim na kesa sa physical aspect. Okay? And it also needs to be a respectful one. Hindi yung tatawanan mo kasi ano ba naman to? Mga ganyan. Kasi there are some beliefs or yun nga, mga sinasabi ng ibang tao na parang ano ba yan? Yung parang weird. Kasi you're not used to it. Pero siya, yun ang spirituality belief niya eh. So all we need to do is to be respectful and non-biased. So again, you do not impose or impress on your religion, okay, or your beliefs. You may share, but making sure you don't, hindi siya yung to the point na very excessive para i-convert siya. Ganon. Hindi pwedeng ganon. Okay? So basically, if you all you do all this, it leads to a relevant spiritual care. So individualistic, client-centered, and collaborative. And mas mafe-feel ni patient yan. Meaning, mas mafe-feel niya na this nurse is worth trusting. Mga ganyan. Kasi nga naiintindihan niya ako or yung beliefs ko or yung paniniwala ko. Okay? So this is the spiritual assessment interview. So we now have here the FICA or the FICA. Okay, so we now assess the faith, belief, or the meaning. So you can ask the following questions. So may questions talaga kasi hindi siya yung usual na kunyari pain. O assess the PQRST of pain or the colds pa. Hindi ganun eh. So dapat meron ka ring guide because not all are have the same spiritual knowledge or spiritual tendency. So do you consider yourself spiritual or religious? Okay, so pag sinabi mo kasing spiritual, not necessarily do they believe or belong to a certain religion. Ganon. Spiritual, yan. So, kaya lang kasi napag-i-interchange tong dalawa. Anyway, or do you have spiritual beliefs that help you cope with stress? Ganyan. Okay. So, if the patient responds no, the physician might ask the question, what gives your life meaning? Yan. So, kasi nga, doon ang spirituality. Importance and influence, ang I, what importance does your faith or belief have in your life? Have your beliefs influence you in how you handle stress? Do you have specific beliefs that might influence your healthcare decisions? Yan. So, ina-assess natin. Kasi ang tendency is that, kunyari lang acceptance of cancer or acceptance of the diagnosis of cancer. Cancer is not balance in terms of acceptance for all people. Yung iba maglulupasay na, sisisihin na si Lord, tatanungin na si Lord, ganon. But if you're a spiritual person, you now see beyond the diagnosis of cancer. So you will have, or they usually tend to think deeper the meaning. Okay, bakit ako may cancer ngayon? What is the Lord trying to tell me? Ganon. So, tapos yung pati pag-manage nila. Kung yung isang hindi masyadong spiritual na person, magre-resort agad yan sa, chemo na agad, mga ganyan. The strongest chemotherapy na accepted. Yung iba naman, they will try to decipher muna. What went wrong, what do I need, ganyan. So, pwede pa nga mag-spiritual healing sila, mga ganyan. They will be realizing, they will be evaluating their life. Ano ang kulang? Do I really need chemotherapy, mga ganyan. And some others don't resort to chemotherapy because ang belief nila is that my body will heal itself. So they will now look into ano ba ang mga kulang ko ngayon or ang mga nangyayari sa akin ngayon. So for example, stress. Yan. So they try to one by one eliminate stress. They would now go into yung parang meditative living, yung mindful living para maalis or maiwas na sila sa stress because others would believe na kaya ako may cancer kasi stressful ang life ko, na yung utak ko lagi na lang nagra-rush or nagmamarathon, parang ganon. So others would now resort to not having chemotherapy and healing themselves differently. So they will now rely on, iba-iba, may meditation, may mga ganon, mga ibang aspeto. So again, as practitioners, we have to collaborate with them. We try to encourage them, their pros and the cons. Kasi nga in the medical field, still, cancer, ang katumbas na agad na treatment ay chemotherapy, yung ganong kaso. But not all will be resorting to that. Yun nga, yung iba magsi-spiritual journey muna, yung mga ganon. Kasi nga, cancer is still a dreaded disease. Yung parang mamamatay na, parang ganon. Okay? But definitely, people will be responding differently. Next is the community. Are you a part of a spiritual or religious community? Is this of support to you, and how? Is there a group of people you really love or who are important to you? Communities such as churches, temples, mosques can serve as strong support system for some patients. Their faith is one that is helping them heal, helping them cope with the diagnosis. Okay? So meron yung iba na talagang they strengthen their faith. They work out on their faith kasi it's different to say I believe versus to feel and live that you really believe. Magkaiba kasi 'yon. So young as you are, hindi nyo pa masyadong marirealize to Pero as you grow older and you now live life and earn a lot of experiences, you will tend to go to the spiritual side. I mean, you now tend to the spiritual side. Ngayon kasi more on pa rin kayo, teens so makamundo, hindi naman makamundo pero kung ano yung ino-offer ng world, ganon. Social media, beautiful things, mga ganyan. So napapansin nyo ba, yung mga parents nyo ngayon, kung dati maluho sila, ngayon medyo naglalaylo. Ba't sila naglalaylo? There is something changing in their spirituality. I know that kasi that is me today. Wala na akong pakialam sa high heels. Dati kasi lagi ako naka-high heels because of my height. Sa branded, mga ganyan. Although may mga uso-uso pa rin, pero hindi na yung katulad dati na super. Why? Because, yun nga, nag-change or nag-undergo ng spirituality experience ang isang older individual. Kaya mapapansin nyo, yun, mas religious na ang mga older individuals, mas tahimik na, hindi na gumigimik ang older individuals kasi nga tinatamaan na sila nung finding meaning, mga ganon, spirituality side. Okay? Pag younger persons, not all are, but I appreciate the younger persons who are at their young age striving na rin on working on their spirituality. Kasi parang, ay, ang mindful naman. Part of being spiritual kasi is being mindful. So when you say mindfulness, you now, basta, it's a deeper meaning of thinking na you get to find reason in your actions. You tend to be more careful when you act. You tend to be more rational when you buy things, mga ganyan. Or when you talk. Dati, walang preno. Yung pag younger, walang preno sa bibig yan. Away kung away, di ba? But when you grow older, you tend to be more, mas kalmado ka ba? Hindi kayong patulera. Hindi kayo mapatol agad sa away, ganon. Ganon na pag spiritual. And you tend to grow more spiritual with age. Okay? So, ganon. Kasi nga, tinuturuan ka ng life, ng experiences. Okay? So, hindi dapat siya, or what do you call this? Ibahin nyo siya sa pagiging, what do you call this? Yung anxiety. Ibahin nyo kasi, although finding meaning, ganon, makes you anxious. Yung parang ganon. Pero it's more of, yun nga, spirituality. There are a lot of people who, because of a lot of problems, turn to spirituality. Yung nagkakaroon na sila ng mga retreat, mga ganyan, finding the self. And in doing so, they now tend to straighten naman their anxieties or their worries. Ganon. Ganon sa spirituality. Anyway, okay? So, and by the way, the community will be a very big part of your development of spirituality. Okay? Not necessarily a religious group, but it could be a group that would now strengthen your spirituality. Okay? And then the address or action in care. How should the healthcare provider address these issues in your healthcare? Which refers now to chaplains, clergy, and other spiritual care providers, which we usually consider kapag may concern ang tao sa ganito. Although not all people will be voicing out their spirituality or religious concern. But deep inside, lahat ng tao meron tong ganyan. Okay, so it depends na lang on how you now gain the trust of your patient for them to go to the extent of sharing their spiritual concerns or religious concerns. Not all patients would want, pag-pray mo naman ako, or pray with me. Not all. But there will be patients like that. And kung makikita nyo sa blue book nyo, meron pa rin, kung hindi pa inalis, ang praying with the patient na skill. And why is that, ma'am? Nurses tayo, but may ganon? Kasi nga, we are considering the holistic patient, spiritual aspect of the patient. Okay? So that hindi pwedeng ibaliwala yon. Kaya kasama yun sa blue book nyo. Praying with the patient, mga ganon, mga spirituality aspects. Okay? Kasi nga, as nurses, talagang we believe na holistic dapat ang approach natin. Yung iba kasi, naa-appease, kung minsan pain. Kumbaga nare-relieve, nababawasan ang pain because of a certain belief or a certain practice. Like for example, meditation. Habang nagme-meditate sila, hindi na sila humihingi masyado ng pain meds. Ganon. Kasi nga, parang nagkakaroon ng relief or curing or treating relief yung kanilang spiritual na beliefs. Ganon. Okay? So I hope you nasusundan nyo kasi hindi siya ganon ka interesting on your end as a teenager. Sana gising pa kayo, no? Ayan, no, kukunti kayo, 43 lang kayo. Ay, 43 plus 1, 2, plus 3 pala. Okay, anyway. Ganon. But, requirements-wise, kailangan nyo alamin ang spirituality and religion. Okay, anyway. So we have the belief assessment tool. So B standing for belief system, E ethics, L lifestyle, I involvement in a spiritual community, E for education, and F for future events. So all you need to do is to ask, ano ang belief system nila? Belief system usually kaano yan ng religion. Okay? Ethics or values, yan, lifestyle. Yan. So lahat yung mga tawag doon ng mga questions na yan would now be under the spirituality assessment. Okay. So taking now the spiritual history, so all you need to do is to look at the acronym SPIRIT. Okay, so S for spiritual belief system, P for personal spirituality, I is for the integration with the spiritual community, R is ritualized practices, I for implications for medical care, and T for terminal events planning. So ang nandito sa table na to are some questions para ma-maximize mo yung spiritual history ng patient. So it's very important that you're guided with questions kasi nga sabi natin, not all, especially young people, hindi sila masyadong mindful or aware sa spirituality. Okay? So that is very important na may guide questions kayo para hindi kayo magkamali sa pagtanong. Kasi baka mamaya you will sound ano tawag doon, parang judgmental pag nagtanong kayo without using your guide. So itong guide na to, gamitin nyo lang for for what do you call that? For assessing. So I want to point you out to this letter T. Tignan nyo to. Terminal events planning. Okay, so itong naaaliw lang ako kasi itong terminal events planning na to, if you will notice. So kasama dyan, no, gratitude. For what in your life do you still feel gratitude even though you're ill? Meron pang happiness dito eh. Okay. Sources. Okay. So kasama din dito yung ano eh, yung finding happiness. Kunyari, the patient now has one week to live, mga ganon. Finding peace kasi in death or in the knowledge that you are dying is still is a very good thing for a patient. So isama natin dyan yung happiness, feeling gratitude, or feeling thankful despite the condition. So it takes actually a very strong spiritual faith, kumbaga, or religious faith to be happy knowing that you are dying. Kayo ba? Happy kayo? Alam nyong 1 week to live. Yan. At your age, hindi pa. Kasi feeling ko, ang dami nyo pang gustong gawin sa buhay kasi you're very, very young. Diba? Hindi pa kayo nag-nurse. Yung ganon. For older individuals though, mas madali ito. Kasi nga, we've lived our lives, mga ganyang concept. Pero yung finding happiness, still saying thank you despite your 1 week to live, kunyari, is a great leap or achievement for a person. Meaning the spirituality or yung kanilang maturity spiritually has been achieved. Okay? So, medyo malalim to for a teenager, pero since you are nursing students, kailangan alamin nyo itong mga to. Ano pa ba ang pwedeng i-point out dito? Implications of medical care. Madali na lang intindihin yan eh. Personal spirituality. Integration. Rituals. Okay. So yun, yung pinaka-interesting diyan is the terminal events planning. 'Di ba? Okay. Kasi parang it's an awakening, parang ganun. Be woke. Nauuso ang woke, W-O-K-E. Yung parang nagising na, ganun ang ibig sabihin ng woke eh. So that ganun yung parang concept sa spirituality. Okay? Any questions so far? Or are you sleeping so far? Okay. So this is a self-assessment, daily spiritual experience scale. None, ma'am. Okay, thank you, Connie. At least may isang gising. Okay, anyway. So not all have a spiritual history taking. Oy, gising daw si Joms, nag-thumbs up. Anyway, not all have a spiritual history taking sa charts. Unless, usually nakikita ko to pag yung may nagre-request si patient. Doon nila pinapalabas tong spiritual history na mga charts or checklists. But not all. I do not see routinely spiritual history charts or pages. But anyway, just in case the patient needs that, you can use this. So that you can just ask the patient to answer. So, andyan naman yung scoring, 1 to 6. 1 being many times a day, 6 never or almost never. Okay? So, ang mga choices dyan is, I feel God's presence, mga ganyan. During worship or other times when connecting with God, I feel joy that lifts me out of my daily concerns. Okay? Yung gano'n. So, you just score yourself, and then this is your assessment brief religious coping questionnaire. Okay? So, ito naman ay yung assessment mo, how a person will cope. By the way andito ba yung kanyang ano? Walang interpretation kung ilan yung scoring. But of course, kasi nga since 1 ang many times, 6 ang never, so the lower the score, tendency is that mas spiritual ang isang tao. Okay? Ito namang next na box is your self-assessment brief religious coping questionnaire or the ARC-COPE. Okay? So, this naman will talk about yung coping subscales or coping mechanism. Is it a positive or a negative coping mechanism? So, may mga questions din dito. I think about how my life is part of the large spiritual force. So, A, is it a great deal for you? 2, if it's quite a bit, somewhat, 3, and not at all, 4. Okay? So, all you need to do again is to let your patient score this. So, since double edge tong questionnaire na to, meaning positive religious na kapag lower ang score, tama ba? Pag lower ang score, I look at God. Okay. Pag lower ang score, mas positive. Pag dito kasi, negative yung questions. I feel that stressful situations are God's way of punishing me for my sins or lack of spirituality. So yung lower score dito is a negative scale or a negative answer. So buti pinaghiwalay kasi at least if you score low in the positive subscale, meaning you have a positive spiritual coping. Kapag naman you score low on the negative subscale, you now have a negative coping. Sorry, you have a negative coping. Okay? So, yan ang some of the questionnaires that you can do or you can make use of to assess your the spirituality of your patient. Okay? So, marami pang ibang types ng questionnaire. But since it's 9 o'clock already, okay, daanan na lang natin ng mabilis kasi last 3 slides na lang. So, you're aware that there are major religions in this world, Christianity, Hinduism, Islam, and Buddhism. Yan pa rin ang major religions. However, marami pa rin ang sub-religions. Okay? So, for example, sa Christianity alone, sa Philippines is we are majorly Christian pero ang dami pa ring sub-religions. Okay? So, ita-take nyo ito actually sa may transcultural nursing kayong course. I think 3rd year. So, iisa-isahin nyo. Actually naman sa religion nyo, di ba? Binabasa or inaalam nyo to. But anyway, so that ang pinaka-end is respect. Okay? Thank you. Do you have any questions? Okay, credits natin. So I'll see you next meeting, exam na, di ba? Okay. Thank you.